laparoscopic appendectomy. Next disease, pancreatitis. First of all, a bit remembrance from anatomy. What is pancreas? Pancreas, this is gland, very soft, that is not protected by cereals. Because of that, it can be lightly damaged by everything that comes to the organism. Pancreas has two functions, exocrine and endocrine. Most part of tissue, the biggest part of pancreatic tissue, makes exocrine functions. It produces different ferments to intestine, and Langerhans glands, the very, very low part, isolates of Langerhans so-called, they produce hormones, insulin and glucagon. Acute pancreatitis, this is a sudden inflammation of the pancreas. There are different etiology, but the most important in different countries can vary. Why? Because acute pancreatitis, this is not only a medical problem, this is also a social problem. The classification that I will give to you, this is Russian classification, Russian dividing of etiology, but in your countries it can be different. In Russian Federation, the most common reasons are two. This is gallstone pancreatitis and alcohol pancreatitis. Because of many problems with alcohol pancreatitis is the most common in Russian Federation. The distinctive trait of Russian drinking culture, this is a high overall level of alcohol consumption and heavy episodic drinking pattern. The big dose of alcohol comes to organs and makes acute damage of pancreas. Because of that, in Russian Federation, the statistic is very, very big because of alcohol pancreatitis. In the world, a bit another statistic. There are countries, for example, where the leading reason is gallstones, and this statistic accompanies with cholelithiasis. So, most common etiology, biliary pancreatitis and alcohol pancreatitis. But there are also many other reasons that can damage pancreas, including drugs, different drugs, including penetrating ulcers and different traumas, carcinomas, radiotherapy, autoimmune pancreatitis, ERCP, post-ERCP contrast pancreatitis, metabolic disorders, different metabolic disorders. And idiopathic, at least 25 cases, we do not know the reason. Why it is important? You should understand that every drug, every poison can give acute pancreatitis because pancreas is very soft and not protected. And here see, in Russian classification, less common, less than 5% cases. For example, scorpion venom. In Russian Federation, this is a very rare etiology. But, for example, in your country, this can be often etiology. And for us, this is exotic scorpions. Pregnancy, fat necrosis, Chinese liver fluke, specific for China. You should understand, etiological classification by incidence is different in different countries. Classification is very simple. Acute pancreatitis is divided into mild, moderately severe, and severe. Mild, absence of organ failure and local complications. Moderately, something, local complications and or transient organ failure. And severe, persistent organ failure. Russian classification, pathogenetical. Pancreatitis can be interstitial, sterile, pancreonecrosis, and infected. Pancreonecrosis, this is local complication. This is destruction of tissue. Why this classification is pathogenetical? This classification gives pathogenesis of pancreatitis. Firstly, this is only parenchymal inflammation reactive. Then it comes destruction because of inflammation, destruction of pancreatic cells, and then it comes infection plus to this, and sterile pancreonecrosis comes into infected pancreonecrosis. Histologically, it can be acute hemorrhagic pancreatic necrosis and acute lipotic pancreatic necrosis, and mixed. Why it is important? Pancreas has very good blood supply from very big arteries. Because of that, surgery in surgery, we always are afraid of bleeding. And if their vessel comes into inflammation, it will be acute hemorrhagic pancreatic necrosis. It is very dangerous by bleeding. How comes the acute pancreatitis? Firstly, it can be direct damage or it can be obstruction of Wirsung duct. If it is obstruction of Wirsung duct, there will be abnormal activation of digestive enzymes that will destroy pancreas itself. And digestive enzymes, they can destroy fast every cell in our organism, especially active form of trypsin that leads to activation of digestive enzymes, and it comes inflammation, edema, vascular injury, and cellular death. This is main pathogenesis of pancreatitis. Signs and symptoms. Pancreas is innervated from solar plexus. Because of that, pain, first symptom. This will be pain from solar plexus, severe epigastric pain that radiates to the back in 50% of cases. Nausea, vomiting, loss of appetite, fuel, like with all infectious disease, plus it can be hemodynamic instability and other symptoms of organ failure. Why? Because if digestive enzymes come to the systemic blood flow, they can damage everything. And first, what they damage is kidneys, then lungs. Because of that, it can be also respiratory distress, peritonitis, tachycardia, symptoms of organ failure. Specific symptoms. There are also many specific symptoms. You should remember what? You should remember symptoms that are associated with, firstly, severe disease like Gray Turner's sign, hemorrhagic discoloration of the flanks. You should remember Mayer-Robson sign. Mayer-Robson sign has two variants, Mayer-Robson point and Mayer-Robson sign. Mayer-Robson point, this is point of body of inner two-thirds that represent the B section of left abdominal quadrant. Why it is important? Where comes pancreatitis, at the head or at the body? Mayer-Robson sign, pain while pressing at the top angle of lateral to erector spine muscle. Very important sign. Remember at least that. Complications. There are local complications and systemic complications. Systemic complications can be by all organs that we have in our organs: renal, circulatory, respiratory, metabolic, gastrointestinal, neurologic, and local. Local complications can be jaundice, pancreonecrosis with abscesses. How to answer this? One more time, remember. All systems of organism can have complications because of pancreatitis. In physical examination, you should find, does he has pain and where? Tenderness by palpation, guarding, peritoneal irritation. This is also a clinical diagnosis, but to understand it, you should accurately, you should make ultrasound. Biochemically, there are no signs that can 100% say this is appendicitis. No, you should make only ultrasound, and in ultrasound enlarging of pancreas by edema, by inflammation, only that can give you accurate diagnosis. Yellow bone, important information for you. Amylase is widely available. Sorry for this technical failure. So amylase is widely available and provides acceptable accuracy, but lipase is preferred for diagnosis of acute pancreatitis. Ultrasound. This is normal pancreas, head, body, tail. Small head, body, and contours of tail. And here, big, enlarged edema pancreas in all of these photos. Computed tomography, normal pancreas with margins, with borders, with small head, and totally destroyed pancreonecrosis here, dermatosis, inflamed, and you see enlarged head here. And here it comes abscess, pancreonecrosis with abscess. Treatment. Conservative treatment, infusion therapy, aggressive hydration, with compensation of hemodynamic instabilities by lactate ring solution, plus antibiotics, infectious disease. Plus, if there is jaundice, if pancreatitis is accompanied with jaundice, you should make biliary decompression. What is general logic in treatment of acute pancreatitis? You should make conservative treatment with specific anti-fermental therapy, but most treatment is symptomatic. Pathogenetic treatment and only one good anti-ferment preparat that has good recommendations and that is investigated in clinical investigations that it has effect is actretid, somatostatin. If there is jaundice, you make biliary decompression. Retrograde, like here, from duodenum, or antegrade. When do we need to do surgery? We treat by surgery only complications of acute pancreatitis. If there is necrosis, pancreonecrosis, we should make sequesterectomy. If it is infected necrosis, minimally invasive methods for necrosequesterectomy and drainage. All methods should be minimally invasive, because if you do big operation, if you will do in acute phase some big operations, you will become bleeding. It is very, very dangerous. It is the most dangerous complication of pancreatitis. Because of this, only in stable patients you can make endoscopic drainage, minimally invasive, only in stable patients, and necrosequesterectomy. Mini-invasively, it can be also made endoscopically through endoscopical transluminal necrosequesterectomy. Firstly, it comes drainage here in the lumen, and you come to pancreas. And look what we have in pancreas: necrosis, black necrosis. You make necrosequesterectomy there. This is the scheme for you, how it comes: drainage, endoscopic transluminal drainage, and then you make necrosectomy.